Hello everybody, we're back again for another session of Facebook Live Stem Cell Debates. I'm Dr. Robert Watkins, orthopedic spine surgeon here in Marina Del Rey, and I'm with Asher Milgrom today. Thank you for coming.
Thank you for taking me.
You bet, I appreciate it. And so today's talk is going to be again on stem cells, and that's kind of a generalized topic that everybody hears about, everybody's grandparents and kids, and everybody asks about. Professional athletes ask about, hey, is there something to this stem cell? Can it help me pitch a little faster? Can it get me over those nagging injuries to let me go longer and everything else? So it's a big topic. Within that, there's a lot of varieties within it, and as we're learning, it's not just the cells you inject, but what effect they have on the body and what growth factors and other proteins go in with it. So stem cells is kind of a generalized term when in reality we're talking about multiple factors going into that. And so my guest today, Asher Milgrom, I'm going to let him introduce himself to give you a better picture, but basically he and his wife are in practice. You have an office up in Beverly Hills and in Irvine, correct?
Correct.
And they do regenerative medicine, and so they're on the forefront of these newer techniques and products that are coming out and how to help people overcome pathology and even potentially regenerative medicine. So I appreciate you being here, and I look forward to a good discussion about stem cells and everything else that goes along with it.
Indeed. I got to say before we even start that it's really an honor to know Rob and to work with him, to collaborate with him. He's a luminary. You guys all know that because you've been watching him. And it's just a very enriching experience for us to be collaborating.
Thank you. I appreciate it. It's great. And it's great to learn from. LA's so great because there's so many people in so many different fields doing different things that to be able to get together and learn from each other and see where things fall out and what makes sense. And ultimately, for me, it's what can I do in my patients and people that I care about and trust, what can I recommend to them? What's safe? What's worth the money? What's worth the time and effort? And so that's the process. That's why that's why I'm doing this. That's why I'm here on a Wednesday at 6:30 at night without my wife and kids playing basketball in the backyard. But it's fun, and there's a lot of great information, and Ash has been very generous with his time to be here. So tell us a little about yourself. What's your background?
Well, I went to graduate school and medical school a million years ago, back in the 80s, and I continued in a PhD for biomedical sciences. The science of medicine interested me more than the actual doing it of every day. I kind of like thinking about what's next, and more so than doing what's now. My wife, Dr. Pien, is an amazing clinician, so she's the medical director, and I'm the science director of our practice. And we've been specializing in regenerative medicine since about the year 2000. Before there actually was the term, we figured that we wanted to work physiologically, working with physiological systems in the body, augmenting them, supporting them, encouraging them to do what they are supposed to do when the person is at optimum health. Obviously, patients come in when the systems are not at optimal health. So if you can get those systems back online, the body pretty much rights itself. There are technologies that can support that. And truthfully, stem cells right now are the holy grail of regenerative medicine. And I suppose we're going to be talking a lot about that.
So let's get into that. And our audience, we've got such a mixed crowd of doctors and physical therapists and normal people and chiropractors that we'll get into some details, some specifics, but we'll also try and keep it generalized to really make sure we're not losing anybody and not boring you completely. I think an NBA Finals game is on right now. Anybody watching is really hardcore. I shouldn't have told anybody. We're going to lose half our audience.
I'm out of here.
You can hit TiVo, you hit pause, you can come back to it later. But so anyway, we'll talk about the types of stem cells. Just a quick review. You got bone marrow aspirate, which are the most common orthopedic type procedure. You have fat cells from adipose tissue, a lot of times from liposuction that then can be processed to get some type of stem cells. And then there's amniotic fluid and umbilical cord cells, which are two different things, but that's basically from a newborn, from an allograft. It's from another person. It's the umbilical cord or allograft. They're not yours. They're taken from those cells and processed in a way to be able to be injected into somebody. And so you mainly do the umbilical cord cells, correct?
Right. Mm-hmm.
And what do you think the benefit of those are?
Well, they're a lot more powerful than cells taken from an adult. Even from a bone marrow or from the fat of an adult, the umbilical cord stem cells are nascent. They're brand new. And they have a much higher ability to duplicate and replicate themselves. They're much more active. I mean, the numbers are extraordinary. If you take an adult cell and a stem cell and put it in a petri dish and nourish it for 30 days, that one cell will become about 300 in 30 days. That's not bad, 1 to 300. But if you can take an umbilical cord mesenchymal stem cell, nourish it in that same petri dish, in a month it'll be like 1 billion cells. So that's the difference, and so you want the power, the potential of these nascent cells.
But that being said, I think a couple things I've seen. One is the longer you grow cells in a petri dish, the more likely you are to get cancer
Absolutely.
type of cells.
Mm-hmm.
And that's part of the risk, isn't it? Is the more powerful these cells are, the more potential chance they turn on, become a cancer, never turn off. We can't stop them. So I guess how do you evaluate the risk in that?
Oh, good point. The term here is expansion. Are the cells expanded or are they nascent and unexpanded? The only kind of cells that we use here in America that are legal to use are unexpanded cells. So the cells that are harvested from umbilical cord, for instance, they have to be immediately processed and distilled and checked and verified, all that kind of stuff, and then frozen immediately without expanding them. So the generation is not growing. And so you're getting the cells almost directly from the donor directly into the recipient. Expanded cells are used in other countries, but they're illegal to use here. And quite frankly, for exactly the reasons you mentioned, the more they expand, the more they lose their potency, and the more there is the possibility that some of those cells go in a wrong direction, down a wrong path.
Gotcha. So when you're talking about taking umbilical cord cells and putting them in a petri dish and them expanding more than adult stem cells, but we're not really doing that with these umbilical cells. We're putting into people for those reasons. I guess the question is, when you take those umbilical cells and you put them in a person, you transfer them to another person, we're kind of assuming they have the same potency as demonstrated in the petri dish, but as we just said, we're not doing that. We're putting them straight into another person. How do we know and how do we test that they have that same degree of potency when you put them in another person as compared to the petri dish? How do we know they're really doing all that?
Well, there are ways of testing it, and certainly there are the clinical outcomes. I mean, ultimately, what matters is the patient getting better. How do they function? How are they being repaired? How successful is the treatment is. And that's a functional issue, which does vary from patient to patient because no two patients are the same physiologically, and they have different levels of damage or disease, whatever you're using the cells for. But there are things that you can look for, and one of those are the growth factors and the exosomes that are released from stem cells. And you can measure that in people and see that one set of treatments are more potent than another set of treatments. And those kind of studies have been done.
And so are you aware, have those studies been done comparing bone marrow aspirate cells, stem cells versus umbilical cord cells as far as growth factors? Like a really good, nice, clean study?
Well, very difficult to do a double-blind kind of study, again, because every harvest and every patient is going to have a different physiological landscape. So at this stage of the game, I don't think there's enough data out there to say definitively.
Yeah.
Because if you can't do a double-blind kind of study, then you need a huge database in order to compare those results.
Right.
And so a lot of the data that's coming in is basically anecdotal. You have these clinical studies that are going on, and the clinicians are reporting what they're seeing, but it's very difficult to compare one to another.
On the hardest part about clinical data that's coming in, and we deal with this in spine surgery all the time, a new product comes out, whoever originates the product and starts putting people in the first people are very enthusiastic about the product, and so they're stoked about it, their patients are stoked about it, they're excited about getting this new device. And we've seen that the placebo effect, which is some degree, is about 30%. People get about a 30% extra improvement just if they really want to and if they believe it's going to happen. And so what we see in spine surgery a lot in different implants is the first wave, it looks great. 90% outcome, all this kind of stuff, and all these case reports, individual cases that are collected, they all look great. But then when it really when other people start using it, not the inventors of the product, but other people start using it, the results drop down by 10 to 20%, and then when we start comparing it head-to-head with other things, it typically fades. There's kind of that shape curve of great enthusiasm, then slowly drops down. And that's the hard balance is that it's really hard to get good data because, like you said, you're not going to have 1,000 people on both sides and evenly matched. But at the same time, the flip side is that early process of just relying on case reports we've seen is so unreliable time after time in medicine that it's hard to really,
It's hard.
know where the data is.
Especially if you're trying to compare theories of why
Right.
something works or doesn't work, because it's been pretty much proven every 8 years our theories are proven wrong anyhow.
Right.
So really, you're trying to measure the outcomes, and it's very difficult to do that.
Right. Well, and to that degree, I've mentioned this before, I'll reiterate it just because my understanding of stem cells and of PRP 1 year ago, maybe even 6 months ago, was that whatever cells you were putting in there were the cells that were doing the work that you wanted them to do. You inject stem cells into a knee, they become the cartilage. And
No,
now,
that's
and
totally
now,
wrong.
well,
Yeah.
exactly, that's what I'm
Yeah.
saying. And now everybody in the business is saying, oh no, the cells you inject in there stimulate the host response and the growth factors and the quiescent, quiet stem cells to wake up and to do what they want to do.
Exactly.
But that's a pretty fundamental shift of theory. That it was like, it's kind of one of those things where it's like, oh, no, that doesn't work. So we shift the theory to adapt to kind of the conclusion we want to have, just a new, more convenient theory to get there.
Yep.
Which,
Well, that's the difference between academic medicine and clinical medicine.
Right.
Because the academics in medicine are really pursuing a theory that they can prove one way or another. That's how you get the Nobel Prize.
Right.
But the clinicians, you say, you know what? I just need the outcomes, and then I'll back my way into a theory that supports what I see happening.
yeah. And I'm kind of stuck, I think I'm kind of stuck doing both to some degree, where presenting papers and giving lectures in front of our,
Colleagues,
colleagues in North American Spine Society and a lot of, doctors and researchers and academicians, you got to have both. You can't just stand up and say, I've had 5 case reports, people did great. People will boo you off the stage. So it's this balance. At the same time, I'm in private practice, so to me, it's not very theoretic. Whatever I put in somebody has got to work with some chance, and that's why they're there. But yeah, and we all live in that spectrum of.
We do. And by the way, for those of you who aren't in medicine, when you're looking for a good doctor, that's exactly the kind of balance you're looking for. Exactly what Rob just said.
Right. I appreciate that. So let's talk about viability. Because what I found is because we don't have real good controlled studies, the academic research we want right now, I've just kind of realized that everybody has their own technique. It's like if you're used to doing bone marrow aspirates, well then you tend to use that. If you're not really used to doing that, then maybe you've got a lot of fat cells. If you're a plastic surgeon, you tend to use adipose to get your stem cells. If you want it to come in a freezer where you can take it out and use it quickly, then people tend to use the umbilical cord. And I know that's a gross generalization, but it's interesting that when I'm trying to find out some research and some data as to what makes sense and what are the counter arguments, you kind of have to go to the competitors, these 3 different groups, and say, what are they saying about the other 2? And because it's their competition, right? For all intents and purposes. And the Regeneration, blog that we discussed, Dr. Patel, Shanak Patel, who was on earlier, he uses Regeneration, which is a bone marrow aspirate derived stem cell type of product. And so he's a big advocate of that. So he's sending me all the information and the blogs on that. And their biggest claim is that they claim they have studied umbilical cord stem cells and shown almost no viability. That they claim the amount of viable cells is like 40 compared to bone marrow aspirate cells are like 5,000 viable cells. What do you have to say about that?
Well, the data that I look at is totally different.
Yeah.
Like there's no question if you're doing a bone aspirate from that actual patient, and going from the patient to the lab table and right back into the patient, even that process, the distilling and the cleaning and whatever you need to do to process those cells, you're going to lose some of those cells. Now, if you're doing any kind of cell extraction, whether it's lipo or whether it's bone or whether it's umbilical cord, and it's going to a separate lab where it's processed and eventually frozen, you're going to lose more in that process as well. And all of those have been studied because you can then thaw out the cells in the specific way that they need to be thawed out and look what percentage of the cells are actually alive. And those numbers should be verified. And by the way, this is important, that whatever lab you're using, their verification has to come from a third party.
Right.
Don't ever trust the lab is, oh no, we verify ourselves. No, thank you. All right.
And the hard part is you got to know who the third party is.
Yeah,
is it the cousin? Or right. It's hard.
That's too funny.
Right.
It's true.
Right. And we do. And you wouldn't believe people are shocked in medicine. One of the great things I learned from my dad is you assume certain processes are just taken care of. It's like you buy a car, you assume the tire was made correctly. And my dad taught me, no, you need to go find out who the person is and what they're doing. And if you go visit their plant or go look at the processes, sometimes it's shocking that it's some guy in the back garage mixing something up or whatever it is. And it's really a fascinating process. You can't just assume anything. And so what is the source and where is it coming from? Who's testing it?
So I use labs that verify their numbers from more than one third source. They have a third and a fourth, sometimes even a fifth. And I want to see the numbers corresponding. So, and there are labs that are confident enough to do that. And they're willing to spend the money. It requires some funding to get those things done.
Right.
Very important. So the viability, of the mesenchymal umbilical cord cells that we use is, between 85 and 95% depending on the harvest. And that's very good.
What about infection? I mentioned this before too. I had a patient who got a umbilical cord stem cell injection. I think the lab was Livion, the one that hit the LA Times in Long Beach. And as we've mentioned, the way they process, if you process, you got to get rid of any type of risk for infection. So you have to process them to a certain degree. You have to freeze it. You have to handle it a certain way. But at the same time, if you over process the cells, you may kill the viability. And
you will.
Right. And so do you think that's pretty well established now? The procedure for processing these cells to really make the risk for infection almost zero, but still preserve the viability? You think they have that down?
Well, unfortunately, different labs do different things, and there are some labs that do the minimum required. In other words, they'll take the cells and then special lab, they'll grow out the cells in petri dishes and look for things that are nasty that are growing in those petri dishes, and they'll just test for the things that are required by the FDA. And then there are labs that go way beyond that, and they'll test for many more things. And that's the kind of lab you want to look for.
Yeah.
Yes, there are regulations, but the standard has not been ubiquitously administered across the field.
Yeah, gotcha. And going back to these growth factors, which is a fascinating process where, so we're injecting different products into people, hoping it's going to stimulate a certain reaction in the body. And right now we've got PRP, which is platelet rich, some with white blood cells, some without, some to get an inflammatory reaction, some without. We've got PPP, platelet poor plasma, which is just the opposite of PRP for certain indications. We got Regeneration, interleukin, A2M, we got stem cells. And the fascinating part for me is, like, if you sprain your ankle and you get you've injured it, your body sends an inflammatory reaction down there. We know some inflammation is good because it's healing the body, but too much inflammation is bad. You ice it and wrap it to get rid of some of the inflammation, take anti-inflammatories. So this process of how to heal the body with how much inflammation is good versus how much is bad, what factors are good, what factors are bad, you realize it's so multifactorial. It depends on what body part, what age, what reaction the person has to the body. That, to me, the idea that you're going to inject one, and let me just say, there's probably 100 different factors we know about. Growth factors, stem cell factors, and angiogenesis,
cytokines,
interleukin. Thank you. Just blah 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 blah. There's interleukin 1, 2, 3, 4, 5, 10 of them. And so my point about that is that so multifactorial and individual in the person. It's kind of crazy to think that you can inject one thing and it's going to stimulate the exact reaction that we want in that person for that body part consistently. Doesn't that just seem like a stretch?
Well, kind of depends on your whole approach to physiology and medicine in general. The body, our physiology, in our opinion, is like the mind of God. I mean, it is unfathomably complex how it works.
Right.
And every year we're just adding layers and layers and dimensions of interactions between things that we didn't even know existed a few years ago.
Right.
And how does it all work? How does it all stay in balance? How does it all communicate and know exactly what to do in different situations? Well, the body is programmed with all that information. And generally speaking, for those who have a more holistic or naturopathic, physiological approach to medicine, they think the idea is to try to bring the body back into balance so it can do what it was designed to do. And as long as we're doing invasive things, we seem to upset that balance. Okay, and so from that perspective, the cells will turn on or augment or amplify the body's natural wisdom. You can look at it that way. And perhaps that's why things seem to work so well.
It's an interesting, optimistic view
It is.
of the human body. I like it. It's inspiring, but the fact that the idea that the body knows what to do is kind of a theory to some degree. Another idea would be the body's just doing. It's not necessarily, it doesn't necessarily know to do better or worse. I mean, the body in some ways also degenerates, forms cancers, forms tumors, it dies, it gets arrhythmias. And so in some ways, assuming that you're going to inject a stem cell into someone and the stem cell knows what to do and the body knows what to do with it is kind of a leap of faith. It's almost religious.
No, there's no question. There's a spiritual dimension to that if you are open to that kind of thinking.
Yeah.
But the fact is that when the cancers occur or when the sicknesses occur, there is something that caused an imbalance, like an autoimmune disease.
Yeah.
It's not that necessarily the body just went haywire on its own, though those kind of mistakes genetically do exist.
Right.
Right.
No doubt.
So, and they're
all
inbred
on
in
its
the
own.
genes.
It did it all by itself.
All by itself. It just
no one to blame.
It
just happened.
You woke up one morning and you're in the weeds. What happened?
Yeah. Right. Exactly.
So there's that too. So you
Right.
mentioned multifactorial. Add to that multidimensional.
Right.
We're just scratching the surface.
Right.
Of all of these things.
Right.
Trying to find our way to make things happen that are reproducible and reliable.
Right. So we'll get back to a little bit of factual basis. I veered off a little bit, but I appreciate that. So as far as testing the growth factors that come in these umbilical cord stem cells, again, the Regenex has claimed to test this. And they test StemVive and Livion, which are both products from the Utah Cord Bank, that are umbilical cord stem cell products. And they basically said that yes, these products did have growth factors in it, similar to a PRP type of concentration, and growth factors that we assume are good, the ones that actually regenerate material. But I thought it was interesting, they also found interleukin-8 and a couple other inflammatory mediators. And that's something that it relates to what we were just talking about, is we assume if you inject stem cells into a person or PRP or whatever into somebody, that's going to stimulate a good thing. Because we're all good people and whatever we put in there is going to help us out. But the reality is what you inject in there may have other growth factors like inflammatory mediators that aren't necessarily going to stimulate a good reaction. It may stimulate some bad reaction or too much inflammation. And again, it kind of comes down to what's the pathology you're treating. And do you want a little bit of inflammation or do you not? And so I guess my question with that is, how do you know what growth factors are going in with the umbilical cords that you're injecting, and how do you know they're right for each pathology?
You don't.
Yeah.
All right. Now, many different labs and different practices have done these assays on the exudate, the soup, the chemicals, the messaging molecules that these stem cells produce. Yeah. And by the way, that's what exosomes are about. Exosomes are these little tiny packets of these messaging molecules that stem cells release that stimulates the native cells in your body, which you mentioned earlier. And so there have been many assays done. And depending on the source of the cells and how the assays are done, it's pretty consistent from exam to exam or assay to assay that these cells do release a whole soup of things. And generally speaking, looking at the clinical results, I don't know, they seem to do the right thing. Mm-hmm. For instance, these mesenchymal umbilical stem cells have been used and approved even by the FDA to be used in severe cases of graft versus host disease. So when someone has a transplant, and they did all the matching, and yet the kidney is being rejected. Yeah. Right. So this poor person who received this kidney is in a perfect storm of an autoimmune, horrible. It's going to kill the organ. It's going to kill the patient if it goes too long. Right. And if you put these cells in the body, it just quiets that reaction down immediately. Yeah. So how do they know to do that? They do it. Right. And that's been proven many times.
Do they always work?
So far, it's always worked.
100%.
100%.
For how long?
Well, generally speaking, once the storm is quieted, then you can get control of the situation. But and again, these studies haven't gone on for very long, so we don't know how long it will go. Right. I mean, we're at the tip of the spear here. Right. So there's so much we just don't know, but we do see that consistently happening.
What conditions I saw, and I know on your webpage I saw, the amount of conditions you have listed for potential treatment for umbilical cords, including arthritis of every joint in the body, liver disease, kidney disease, heart disease, autism, Alzheimer's, neurologic type of conditions. It's pretty much all the pathology that affects humans. I guess I got two questions for you. One, are you a little bit weary about treating this myriad, this whole panacea of diseases? Like, for instance, I just do spines.
Right.
Because, it's like, that's enough. There's so much going on with spines that the other parts of the body, I don't have a big enough brain to remember all that about everything going on in the body. Are you a little bit, are you comfortable treating all those conditions? One, just as a clinician taking care of people, and it's a lot of disease, and I guess, and in related to that, it's hard for me to believe, I guess, that one treatment cures all that stuff. So I guess it's a multi-level question. Maybe you can just answer the first question. Are you comfortable treating all that pathology?
Well, we don't.
Yeah.
So when I say on our website and some of the videos that we produced, these are all the ways that those kind of cells are being used today. And I post, there must be dozens and dozens of articles. Every week I'm posting more articles so that people who are looking for information can get this straight dope of what's actually going on. And they can go right to the articles and read them, etc. We use them primarily for interarticular or bad joints, degenerated joints, whether it's injury or arthritis, or sometimes infected joints that have deteriorated. We use it a lot for that, and we get pretty much 100% good response from that. The other
for how long?
Well, again, we've only been doing this for 3 years, since the cells became available, almost 4 years.
Right.
And some patients do need a second or third injection of these cells, but they always seem to move the patient. They do. They move the patient in the right direction. I'm a good example of that.
Do you think it's actually regenerating cartilage?
I know it is. I know it is because I have the MRIs from my knee. 4 years ago, I was due for a total knee replacement. Over at Cedars. And I didn't want to do it. Because I've had so many surgeries already. My knee's just a mess.
Would you be willing to share those MRI
X-rays
with us?
Yeah,
Will
sure,
you? Yeah. We'll post them. I'll get my knee guy. I'll pull out my knee guy to take a look at them and evaluate them. You up for that?
Totally.
All right, let's do it.
So,
what percent of people do you think, because the orthopods I know who do these injections don't claim it regenerates cartilage, and they're doing the similar type of procedures, but they don't go that far. But it may be because going through a medical background, part of it going through medicine and 5 years of residency and being grilled on a daily basis by our attendings. If you're going to say something, you better be really sure about it. Otherwise, you'll get crucified and have to do double call and stay up for 48 hours straight. So we've been beaten into submission that we're a little weary of making claims, and they do these procedures, but they don't claim regeneration of cartilage. More what they tell me is an anti-inflammatory that can buy time. And if it buys you 6 months, well, then that can be great, But you actually think regenerate cartilage?
Yeah, I was walking on 2 canes, excruciating pain, and I had pieces of articular cartilage floating around on my knee.
Right.
And we call them floaters.
Right.
So first we have to pluck that stuff out of there because that's not going to do you any good. And within a few weeks, I was much more comfortable.
So you had surgery,
arthroscopic
surgery, and had them debrided.
Oh yeah.
Well, how do you know that didn't do it? You got to give your orthopedic surgeon some credit. He cured you with the scope.
He took the junk out, which was needed because it was tough. No, look, good surgery when you need it, it's needed.
Right.
So I'm sitting next to one of the best here.
Right.
So, but the surgery doesn't cause regeneration. It just tries to stabilize the situation and not make it worse.
Yeah.
So, the regenerative capacity of the body is enormous. If we can get it to go, it will go to whatever extent that it can.
Well, but the difficult part about that too is the biology and the biomechanics. In general, if you get loss of cartilage, you've got a biomechanical situation where you can inject some new biology in there, but without the perfect biomechanical situation, which is what your knee was when you're 15 years old, the biomechanics are still off.
Oh, totally. My knee is a mess.
The chance of the cartilage regrowing as it's supposed to and staying there when the biomechanical situation is still pathologic is a stretch.
I'm going to get even the newer MRI.
Yeah, all right, deal. Let's check it.
It's been years since the first one.
Yeah.
But I never looked back.
Yeah.
I was debilitated. And,
now that being said, some people with degenerative arthritis, the knee gets inflamed, it hurts like hell.
Oh boy.
And then you can even get a cortisone shot, get rid of the inflammation, or just write it out. You can meditate and just relax and write it out. And the inflammation, doesn't just progressively get worse all the time. It can flare up and settle down on its own. The knee kind of burns out, the pain mediators burn out, the inflammation can settle down, where your knee pain can get better with arthritis, without surgery, and without any stem cell injections, just the natural course of healing.
The
and
body
life.
healing itself. Yeah.
And well, that's optimistic to say it healed itself. For more, it's just that the inflammation went away. It got inflamed and it settled down.
Well, the body has active systems to deal with inflammation.
Yeah, no, believe me, I'm not against the body, but let's transition just a bit. You mentioned the FDA. Where does the FDA stand on umbilical cord cells? What's the approved indication? Is there approved indication?
No.
What's their stance on it?
No,
Do they have one?
the first thing is, and the reason why the USA is really lagging behind other countries, behind Japan and Singapore and Germany and Panama now because of Reardon's operation down there, is because they were very concerned about this, for the first 5 years of the 10-year history that we have on this now.
Yeah.
And so they required all sorts of studies and data to be sure that the cells don't do any harm. It doesn't cause cancer, it doesn't give you dementia or whatever.
Right.
And when that was established, they started allowing clinicians to start using them.
Right.
Okay? But they didn't approve the use, they just relaxed the disapproval of the use.
Right.
So there are no specific indications that are approved, although there are many FDA-sanctioned studies on the use of these cells for different conditions.
Right.
And so the question is that going to change? Are they going to, put the hammer down and disallow them,
right.
or say that you have to use them only in a specific kind of case?
Right.
And that's constantly changing. It is a changing landscape. We're all trying to keep abreast of it, and the object is.
Can you? So right now,
Mhm.
you can inject in the joint. They're
Absolutely,
okay with that.
yeah. You can inject them in the blood, in the joint, and you can pretty much use them. However,
Can you inject in the spinal cord?
you can, and there are lots who do it.
So as long as you notify the patient that this is not FDA approved,
Right. You have to do that.
Informed consent.
Right. There are special informed consents for experimental kind of non-approved,
Yeah.
but not disapproved,
Right.
procedures.
And can you say you're using? What do you have to call it? You have to call it an allograft, umbilical cord allograft that
Right.
may have some stem cells in it, or do you not even use the word stem cells?
Well,
Do they have an approach on that? Have
They
said?
do, and
Yeah,
quite
yeah.
frankly, there's a lot of gray area
Yeah,
there
yeah,
because from a marketing perspective,
Yeah.
the buzz.
Yeah. Right. Yeah.
is
Right.
Stem
It's
cells.
huge. It's huge.
And so to say I'm just using some tissue that I extracted from a placenta and I'm going to put it
Right,
in you,
right.
it doesn't have quite the appeal.
Don't they know the placenta is the holy grail? It's going to heal everybody.
Well, boy, we've seen some stuff.
Yeah,
I'm going
yeah.
to tell you, with just using raw placenta
Yeah.
on burn patients, there was just
Right.
extraordinary healing going on. There's so much we don't know.
So let me ask you this: going back to, it sounds pretty safe. Then it comes down to the cost, as far as you inject something in somebody, and like has been documented, is you stick a needle in someone's body and you charge them money and you tell them this is going to work. There's about a 30% placebo effect that people get about 30% improvement. And Dr. Batten, who was on earlier, who's one of the team doctors for the Rams, said that's kind of what he's seen with some injections, is people's pain may go from like a 5 or like a 6 to a 3 or a 4 to a 2, which is some improvement, which can clinically be beneficial, especially if you're an athlete. You got to go play in a game that night, and if your pain's a 4 versus a 2, that makes a difference, and maybe worth the injection.
Yeah, worth a career.
Yeah, right. But the question is, I guess for a lot of people, it's kind of like, well, how much is that going to cost? Is it $500 or $5,000? Depends on how much money you have, but how much is it going to cost? How long is it going to last? Is it worth the improvements you're going to get? Do you have any thoughts about that or comments about that?
Well, yeah, a lot. I mean,
Yeah.
I tell you, first things first, if you're looking for a clinic or a doctor who's going to do this for you, make sure that they really have spent the time to educate themselves and share that education with you. They're not just following a pack because it makes money. So, for instance, on our website, we have a whole series of videos that we recorded, 10-minute videos each one, explaining the science of stem cells, from where they come and from an umbilical or placental source, all the way to how they're used and all the science in between. And we require our patients to watch the videos before they even show up for a consultation, because it's not about selling or marketing, it's about educating. So the patient is in fact capable of making a good decision for themselves with as much data as available out there. That's number one.
Right.
Okay, now beyond that, the question of is it worth the money? Well, that's a big question.
Right.
Now, is it worth the money versus having a surgery?
Right.
That's a lot easier.
Right.
Because the risks of surgery, the cost of surgery, the downtime from surgery, how much time you're going to miss from work from surgery. I mean, there's so much, we know what that's like.
Yeah.
And then, for me, a total knee replacement, I was going to be pretty much incapacitated for many weeks,
Right.
and then the 6 months of physical therapy versus the 5-minute injection, and then a few days later I was walking around pain-free and on and on. I mean, there's no brainer there. Even if it didn't work well, still no brainer to try it. So it depends really on the situation and what you're trying to cure and what the other options are.
Right. So I think what I'd like to do, I think we'll wrap it up. There's a couple things I want to follow up on. Number one is get us those studies, get us your MRI and your X-rays.
Yeah, I'm really curious to see my current MRIs.
Yeah, that'd be great. And I'll post them. We'll figure out a place to post them. We'll put them on Facebook and whatever. And I'll compare them and I'll have an orthopod look at it, see what he thinks. Number two is, I think it comes down to a lot of this viability of the cells and the Regenex claiming that the umbilical cord don't have any viability, and your argument, the umbilical cord people's argument, that if you're taking these fresh cells from a young umbilical cord, that they have more viability and vibrancy and potential than old people's iliac crest, because you're an old person, so your cells aren't as viable. And that's an interesting theoretic thing that I think we need to get some more data. I think that's probably the crux as to which stem cell product would be most used, because they both sound pretty safe. And so I'll follow up on that. And if you have any information, we'll look for some studies and I'll put that out there as to see if we can get a head-to-head comparison. I think that's kind of the crux to the issue. But at the very least, we'll take your case report, your personal case report of yourself, and look at the studies and see where that stands. So as far as following up, in the comments section, I'll put Asher's information, his contact information, phone number, and their webpage. What's your webpage? What's the best way to contact you?
www.amaregenerativemedicine.com or amaskincare.com.
Okay.
We do a lot of skin work.
Yeah, okay, that sounds good. And then, and for me, we've got the Back Doctor app, our free app that has the whole rehab program. If you want to avoid back surgery, get your core strong. And we've got all our whole exercise program in the app, so check that.
Exercise. See, that's
the whole other part.
Oh my God, who wants to do that?
Yeah, exactly. What? Just get a shot. You don't have to exercise.
Exactly.
Win-win. And so I appreciate you guys joining us on a busy night. We can get back to the game now, but please leave us any comments. We'll respond to those. We appreciate you joining us. If we can help in any way, our webpage is watkinsspine.com, and your webpage is amaregenerativemedicine.com. Great. All right. Thank you. Thanks, Asher. Appreciate it.
All
right, buddy.
Honor.